My dear friends, I am Dr. Thompson Akwo, Ntuba international physician, preacher, politician, and publisher of Health and Development magazine. And I want to speak to you today on global health leadership and governance, global health governance leadership. But before that, we have to look at uh, health systems, health systems. And before I had talked about the structure or composition of the different health systems uh, of nations, as a former chairman for health for Southwest Elites Association in the Cameroons, one of my uh, terms of reference of work with my committee of 13 people of very highly qualified people in the healthcare sector was looking at the priority health issues within that region, and then to be able to put forward policies which were to be implemented, and by so doing improving the healthcare outcomes, and also making sure that there was equity, making sure that there was equity. This past 7 months, or for 7 months, I have spent time in certain communities in the state of Louisiana. I was in Jefferson County, in a number of the little towns and cities like Cana, and in Saint Bernard and Saint Bernard. I said that to say there is the HIV/AIDS program of Louisiana, which is called Louisiana Can. And working with Christian Health, I was part of the Black Health Summit. And the Black Health Summit was looking at these issues from the, the Black minority communities. The health inequities within this community is very alarming. But that notwithstanding, there is a lot of work that is ongoing, and there's a lot of progress that has been made. And in all of that, we look at minority health as a component of, of the American health system, right? So if we are looking at global community health, we will have to address that. But going back to what I talk and and say is global health leadership, global health governance is very, very important, because when we look at health systems, we are looking at the functioning and all the different components and systems, or let me not use system because we are talking about system, the different institutions, the different components, the different organs, the different sub groups in healthcare human service delivery that contributes towards the provision of healthcare for the people. One of the major things we look at in health systems is the health system finance. The health system finance. The health system finance is very, very important. And different countries, uh, they divided into top tier and the middle and the lower, have addressed health finance differently. But when we talk about health finance, we are talking about how healthcare provision is finance. It could be basically divided into the private and the government. And we talk about the provision of insurance. In the United States, we have different types of insurance. There are people who talk about the public option with the Affordable Health Care Act, or what people are calling Obamacare. The shutdown of the government in the United States is related to some of these issues. That's why it's good for us to look at some of them. The subsidies